Hello and welcome to our podcast. I'm Danny, and today Great.com talks with Keely Noyles, the Manager of Philanthropy and Programs at Canadian Physicians for Aid and Relief, or CPAR. If you haven't heard of it, CPAR's mission is to build health system capacity and support healthy lives in low resources regions. Before we begin, remember, if you're new here to this podcast, press subscribe on YouTube or on your podcast app. Hi, Keely, and welcome.
Hi, Danny. Thanks so much for having me.
It's my pleasure. I really want to know more about CPAR today. Let's begin about story, right? How did CPAR begin, and how has you guys evolved ever since?
Absolutely. So, CPAR was founded in Toronto, Canada by Dr. Mark Deutsch, Henry Gold, and Simca Jacobovici in 1984. It was their hope that the unimaginable suffering of the Ethiopian people during the famine of the early 1980s could be relieved in some small part by the work of Canadian doctors. So at this time, CPAR's work took the form of emergency relief by providing food, aid, and medical care to those most in need. CPAR is celebrating its 40th anniversary in 2024, and while CPAR no longer focuses on aid and relief, we and our local African teams continue to help the most vulnerable communities by providing health system capacity and supporting healthy lives in low-resourced regions. So over the 4 decades since it was founded, much of CPAR's work has addressed the social and environmental detriments of health so that families have enough nutritious food to eat, livelihoods to support them, clean water, sanitation and hygiene services, and access to improved healthcare.
That's really, really amazing. And congratulations on that anniversary, right?
Thank you.
It's been quite a journey.
It has, yes.
It's amazing. Kelly, you mentioned Ethiopia, right? Uh, what are the regions actually in a whole that you are able to attend now? And what are the most pressing challenges that they face right now?
So our work is focused in Amhara and Oromia regions of Ethiopia. Unfortunately, they've been suffering from a lot of internal conflicts the last few years. So right now we're having some difficulties with continuing our projects according to their scheduled timelines. So the teams are really adapting. They are abiding by the local rules in terms of whether they should be staying from home and working from home, or if they're able to get back into the field and continue project activities. But those are some of the biggest internal challenges that we're facing in Ethiopia in those regions.
I see, I see. And one thing that I really found interesting about the work that CPAR is doing now, it's how holistic approach is, right? So let's dive into the programs. Maybe give us some
Absolutely.
highlights. I would love to learn more about that.
Absolutely. So you're absolutely correct in saying that our programs are very holistic. They're designed to support the knowledge, training, and inputs that a community most needs. And we strive to build capacity and ensure that the benefits of our programs continue long after we're gone. So our program activities are varied, but all focus on building health system capacity, supporting healthy lives, through training and infrastructure that are climate adaptive, culturally sensitive, and aligned with national goals and plans. So really focusing on building health system capacity and then also the detriments of health. So like mentioned, access to nutritious food and food security, clean water, sanitation and hygiene services, and improving livelihoods.
That's really, really amazing. And one other topic that I saw in my research is that you also have this take on climate change and environment as well, right? Because I think it
Yes.
plays a kind of role when we think about health and especially housing, I think, in some regions because of constructive methods and all of that. What
That's right.
kind of work do you have that goes into that direction?
So All of our programs, we look to encompass some form of climate adaptive technology or training. But one program I can speak to is the Green Schools Network. So this is a program that was started in 2019 in Malawi. And we're basically helping elementary schools to improve access to clean water and sanitation services through construction of rainwater harvesting tanks and latrines. And then using some of that gray water, so reusing the water that's been used for cleaning the latrines or washing hands, and using it to irrigate local small scale gardens. So in the actual school gardens, they grow fruits and vegetables that the students can eat and bring home to their families. They can sell in the local markets to subsidize some of the school fees or buying of school materials like desks and pencils. But then they're also installing non-fruit trees, which helps to provide shade for the students, create barriers to help prevent some of the extreme weather conditions from impacting the students in schools. So dust storms, hurricanes, mudslides. So it's really a holistic project that looks to improve the health and well-being of the students and also the surrounding agriculture and area.
I love when the guests come here and bring these details, like we're planting certain types of trees, we're going to build this kind of specific structure to focus, because it's like little details that change the environment and change the whole thing, right? And actually give people this possibility of a good livelihood. And that's also part of your goals. And one thing that I was thinking here, it's because in your mission, when you say that you work to build health systems capacity, right? That also involves as part of sustainability, not in the environmental sense, but in the sense of that community can keep it moving on.
That's
Do
right.
you have programs that are focused on that right now? What's going on?
So for all of our programs, it's extremely important to CPAR that we're not only responding to the immediate needs of a community, but that we also take a long-term sustainable approach to improve the health of community members and ensure that they can build resilience against the impact of future crisis. So with climate change, we are really looking to address some of the challenges that communities are telling our local field teams that they are experiencing. But we know that with climate change, there are going to be many more disasters that we're not even aware of right now. And so really providing them with the tools, the training, and the infrastructure to adapt and hopefully to be a little bit less vulnerable to some of those extreme conditions that are going to face them in future years.
That's amazing. Really, that's really great. Now thinking about another side of it, because it's great when the programs work and everything goes smoothly, but I believe that there is a whole lot of challenges that you face as an organization, not just as part of the community. What are the most complex ones, the ones that are like most pressing, as I said before, for you as an organization?
Yes, so you're absolutely right. And I think every organization faces challenges of differing amounts. But most recently, the internal conflicts in country have really greatly affected our ability to implement the programs holistically the way that we had hoped. So that's been a great challenge. Also with climate change, some of the working areas that we're in, they're creating new health problems. So our Green Schools project has been focused on providing access to clean water and sanitation and hygiene for the past 4 years. But recently, Malawi is really facing an increase in cholera outbreaks. So because of climate change and the extreme floods that they're facing during the heavy rainfall season, we're now pivoting and including more cholera response and flood response skills and training in our programs. So that's been a big a challenge, but also an opportunity to kind of bring even more knowledge and training to our programs. And then, of course, Inflation. Inflation has been a big challenge for our team here in Canada and also for our in-field partners in Ethiopia, Malawi, and Tanzania. It's affected the price of contractors, our ability to procure materials, the price of those materials. And then here in Canada, it's affected our ability to fundraise for those programs. So we've been working hard, like most charities, to keep our programs going, but that's definitely been something that's been slowing us down. And with most projects, we are planning the budget 1 year, 2 years, up to 3 years in advance of the program starting. And so in those 2-3 years, the prices of materials and infrastructure and contractors can drastically change, and that really affects our ability then to get started right away. So those are just a few of the challenges, but most pressing. And the fluctuations in local currency has also been a recent problem for us. In Malawi, there was a devaluation of their local currency by over 40% in November. So that, again, was something that we had to pivot and make sure that we addressed appropriately to keep the projects going.
Thank you so much for sharing that, because one brings us this perspective of geopolitics that most times I think this is rare, even here on the podcast. I'm sorry, I need to pause to really think about it, because it's really complicated to navigate this situations, this disputes, this history that goes into another country without really letting it interfere in your work. So that's a really important perspective. And I think it is the first time that I heard about inflation. And I like that you said it, because it reminds us that there is a structure behind it, right? And it is an organization, it is a company in some level. And you need to, be prepared and be responsible with the money that you receive, right? With the grants and funds that you receive. So thank you for sharing that, Kelly. It really puts things into a different perspective. Yeah, that was great. Now, going for a positive side of it, what are CPAR's plans for the future? Where would you like to be for the next anniversary, let's say, the next 10-year anniversary?
Wow, let's hope we get there. So really, I think it's really important that I note we rely on the expertise of our local teams. So they're living in the communities in which they work. And because of that, they are the ones that we look to in terms of what are the immediate needs of communities? What are you hearing when you're in the field as to gaps in knowledge, training, infrastructure? And so because of that, we're really making sure that we're addressing the most vulnerable populations, their immediate needs, and making sure that they're sustainable and in line with the national goals and plans for that country. So kind of moving forward, we seek to make an even greater impact by really focusing more purposely on the improvement of health systems. So strengthening the health system will not only address some of the quality of healthcare and therefore health outcomes, but also the discrimination by improving equitable access to healthcare. So, for example, in 2024, we are hoping to launch a telehealth project in Tanzania that will provide mobile health clinics in rural areas. So these clinics will provide ultrasounds and prenatal care for women and young girls who cannot typically access the larger hospitals. So really strengthening their health system and making sure that we're accessing the most vulnerable in rural areas. And so really looking to continue with the health system strengthening side as well as the determinants of health. But that's for the future. We're hoping to make an even bigger impact in that sense.
That's really, really an amazing goal, let's say. I really like it. And with that in mind, my next question has to be, what are the best ways for folks listening or watching us right now to help you keep going, or how they can help and how they can get in touch with you?
Absolutely. So to get in touch with us and learn more about CPAR, you can visit our website, www.cpar.ca. Follow us on social media, support us in that way. We are also a registered charity and not-for-profit, so we do rely heavily on donations for to continue our programs. So really right now, our monthly donors are our bread and butter. They provide that continuous support so that we are ever better able to plan for the future and implement projects accordingly. So it is a donation based, and unfortunately, we're finding that we're having a decline in the amount of disposable income for donors, especially here in Canada. We recognize that people aren't able to give as much, and of course, there are a lot of extreme disasters going on in the world that are in need of support. So, in terms of how to help us, donations, of course, but really just getting to know CPAR and the work that we do and following us on our social media channels, supporting podcasts like this great one would be really great, and sharing with your friends. I think another challenge that we're facing is to really engage with younger generations and get them connected to our cause. So that's something that we'll be working on over the next, hopefully, decade as well.
I urge you guys to go to their page and learn more about their projects. You can see things in depth. You can understand better what they do, the need, and probably how to get more involved and through finding something that talks more to you, calls to your heart. So thank you. Thank you so much, Kelly, for talking to us today. I loved learning more about CPAR.
Thank you, Danny. Thanks so much for having me.
And for everyone watching or listening to us today, thank you so much as well for staying with us for one more episode. And remember, if you enjoyed this episode, press subscribe on YouTube or in your podcast app, because that shows the algorithms that this is an important conversation and more people can learn about the importance of the Canadian Physicians for Aid and Relief, or CPAR. Go check their page, and well, I see you in the next episode.